Hi, I'm Dr. Jessica Shellock. I'm an orthopedic spine surgeon with the Center for Disc Replacement at Texas Back Institute. I'm going to talk to you today about lumbar disc replacement. This is disc replacement in the low back. We also use the term lumbar arthroplasty or disc arthroplasty. And why are we talking about this and why is it relevant? Because we want to preserve motion in the spine. The alternative to lumbar disc replacement is spinal fusion. But disc replacement is used to restore and replace a diseased disc in the low back and put in a device or an implant that is generally made of metal and plastic that allows for motion to be preserved. And why is this important? We know from fusion studies and from a lot of data over many years that when you have a spinal fusion, the levels that are around that surgical level, they work harder. And in order to work harder, they wear out faster. So with disc replacement, if we can preserve motion in the spine, we're not increasing your chances of needing another surgery. The spine is designed to move. We're designed to move. And that's our goal with disc replacement. Now, what does disc replacement involve? As I mentioned, it involves putting in a device, a metal and plastic device. This is an example of one of the options that goes between the vertebral bones and allows movement, just like the natural disc. In order to do that surgery, we have to access the spine. And it might seem strange, but we do that by coming in from the front, because that's where the disc is in the spine. And we do that with the help of a general surgeon who moves things out of our way so that we can safely get to the disc space. And then we take out the diseased disc operatively. Many times the spaces collapse and we have to restore the height, which means you get to be taller. We do that, we get all of the disc out, we trial for the specific size that fits your anatomy best. We can make the size the perfect footprint, restore the height, and often even restore the angle of your spine back to what it's intended to be. And then we put this device in that maintains motion for you. Sounds almost too good to be true. Well, not everybody's a candidate for it. So how do you know if you're a candidate for it? Well, for the most part, patients usually present with pretty severe back pain and often with some leg pain as well. And I'm not talking a few weeks of pain, I'm talking many months of pain, sometimes many years of pain. And in order to be a candidate, you really have to go through a lot of conservative treatment, meaning physical therapy or chiropractic care or injections. Many times patients have gone through medications and seen pain doctors, and the pain just hasn't gotten better. And they may have been told they were a candidate for a fusion. That's when you might want to check out whether you're a candidate for a disc replacement. Now, for us to decide if you're a good candidate, obviously a huge part is the history, like we just talked about. But we need tests. We need x-rays of your spine. We need to see what your standing spinal alignment is. We need to make sure that there's not abnormal movement or what we refer to as instability in your spine. We need an MRI. We need to see if the disc is diseased or how many discs are diseased. We need to see whether there's a bulge that's pinching on your nerves and what else might be causing the pain that you're having. We often will get a CT scan or a CAT scan, and that gives us a totally different perspective than an MRI. It lets us see the bones, the joints. We can make measurements on that to make sure that the implants will fit appropriately for your anatomy. And oftentimes, we'll also have to do something called a DEXA scan or a bone density study. Many people have heard of that in terms of osteoporosis, but it will also tell us whether your bone density is even slightly less than normal. And the thing with disc replacement is that we're asking the spine to support a metal and plastic device in your disc. The bones have to be normal in order to support that. If your bone density is not normal, there's too high of a risk of fracture or failure, and so you wouldn't be a candidate. What else might exclude somebody? If you have scoliosis or a significant curve in your spine, you're not a candidate for the device to function like it's supposed to, so you couldn't have a disc replacement. If you have severe arthritic changes of the joints in the spine, those are going to continue moving, and they'll still be a source of pain if we replace the disc in the front, but not the joints in the back. So in that case, probably not the best option. In the setting of having previous surgery in your abdominal area, there may be scarring that wouldn't make it safe to come in from the front. If you are not an ideal body weight, you may be too deep for us to have a safe passage to the front of your spine, and so we might have to have you get in a little better shape before you might be a candidate. These are a lot of the things that can exclude patients from it. But if you are a candidate and the workup indicates that you are, then the recovery from a disc replacement is usually going to take 6 to 12 weeks of doing therapy and kind of reconditioning and rehabilitating your core. And after 3 months, most patients are back to all the activities that they want to do. Whereas with the spinal fusion, that can take 9 to 12 months. So there's a big difference even with the upfront costs associated with your life and your time. As far as insurance coverage, many patients wonder, is my insurance going to pay for a surgery like this? And the answer is that many insurance carriers now are covering disc replacement for a single level. Some will cover it for a second level. Not all, and sometimes it's a battle with insurance carriers. So you owe it to yourself, if you've had any of the symptoms that I've talked about, if you've been told that you're a surgical candidate but someone's offered you a spinal fusion, come and get an opinion from someone who does both, who can walk you through whether or not you're a candidate for the disc replacement. And if so, we'll help guide you along that path. Thank you so much. Hopefully we'll see you soon.